Most people think acupuncture works by placing needles into specific points along mysterious lines called meridians. But what's actually happening beneath the surface is far more precise. Classical acupuncture appears to be a highly organized map of the peripheral nervous system and its neurofascial network. Across the body, there are more than 360 well-mapped acupuncture points located where nerves, connective tissue, and blood vessels intersect. Stimulating one of these points can create local, widespread, or systemic effects. These points are not isolated. They are connected through a complex anatomical network described in classical medicine as primary meridians, divergent channels, collateral branches, sinew channels, and extraordinary vessels. In modern biomedical language, these pathways closely correspond with peripheral nerve distributions, fascial planes, neurovascular bundles, myofascial chains, and broader regulatory networks throughout the body. Stimulating a single acupuncture point can influence neural and fascial trajectories in multiple directions, affecting muscles, circulation, organs, and system-wide physiological regulation. One of the most studied points is stomach 36, or Zusan Li, translated as 3-mile point. Historically, it was believed that stimulating this point could help a person walk 3 more miles when exhausted. Modern research helps explain why. When this point is stimulated using different techniques, measurable changes can occur in physiological systems associated with digestion, immune regulation, and neuromuscular function. A different angle and depth to the bone can benefit the big toe and enhance proprioception signaling to the brain, reflecting various peripheral nerve pathways. Same point, different pathways, different outcomes. This is why acupuncture requires years of training and practice. Licensed acupuncturists must learn hundreds of anatomical points and the precise techniques required for intentional engagement of the body's neurofascial pathways. What ancient physicians described as meridians and associated pathways appear to represent stylized maps of these neurological relationships. In other words, acupuncture may be one of the earliest forms of functional neurology ever recorded. Acupuncture is not simply a collection of points. It is a method of interacting with the nervous system. Different needling methods access different physiological levels. My name is Dr. Jennifer Williams. I have practiced acupuncture for over 20 years, working with active duty, military, veterans, athletes, and patients with complex neurological conditions. This video is not a tutorial. It is a visual explanation so you can recognize what different acupuncture approaches look like. This is the Integrative Acupuncture series.